Hey, I'm back. It's been a while. This is my 3-month post-top surgery update. I haven't posted for a while because I was busy getting engaged. So that's exciting. So this update, I'm just going to go through kind of my massage routine because I think my scars are really fading a lot, which is wonderful. Definitely what I wanted, obviously. I also realized something I hadn't really thought about. Getting the higher scar placement through the nipples means that, especially because my areola size is quite larger, I have a lot less scarring, right? Like, actual length-wise, I have that much less scarring on my body. They're both 38 mils, so 76 millimeters, so 7.5 centimeters less scar line than if they'd been under my pecs, which is awesome. And minimal scarring the better, I reckon. So I'll just do my oil massage process as I normally do and kind of talk a bit about the last couple of months. So first I put my phone to time for 10 minutes. I usually do 11 minutes just so I have time to get the oil on me. So it's 7 minutes past 5, so I'm gonna go 17, 18. Alarm set 11 minutes from now. Awesome. Okay, so first I get my rosehip oil, shake it up a little. I actually also have Tammany oil, and I open the top before I start putting oil on my body because otherwise it's hard to get on. So this one has a little droppy stick. So I get my little droppy stick, put some oil on here. So as you can see, my nipples aren't black anymore. My areola's all scabbed up. The scabs have come off. It's not actually like they kind of spontaneously fell off. I went and saw Andy about 5 weeks post-op, and he got this little brush thing with some antiseptic on, like a little kind of spongy brush thing, and just brushed them off. And my left nipple was actually bleeding after it got a little brush, so I had to wear a pad over that for another week or something. So at about, it must be about six weeks post-op, can that be right? Both of the nipple pads came off. There we go. Okay. So I've been doing this 10 minutes every day for since the nipple pads came off, so it's 3 months post-op now. It's actually more like 2.5, so yeah, about a month. I've been doing this for about a month. When I first started, I did the little lines. Finn's channel, Finn the Incredible, his channel was really helpful with the massage care. So I did like really light lines first and on this side, and then I started doing this kind of motion after a week, and now I can do circles, which is great because everyone loves circles. So as you can see, the scabbing came off, and this one healed up quite fine. So my nipples, they are pink, but there's also kind of, this one has a little kind of light brown sort of tan part in the middle. I don't really know what that's about. So I've got a lot of mobility back, which is super awesome. I still feel this kind of pulling back hair, but definitely more mobility than I've had so far. I haven't regressed. So I have less scar line than if if the scars had gone under the pec line. Also, I realized, and my housemate, who's a massage therapist, explained this to me, some people's pectoral muscles attach at different ribs. So some people's pecs you might notice are actually quite low and some are quite high. There's this guy on YouTube who actually ended up getting the scar line above the nipples because his pecs inserted so low that his nipples actually had to be quite far down. And I'm not sure if they can tell, if the surgeons can tell before they operate on you where your pec line inserts. So my pec line actually inserts quite high, my pectoral muscles rather. They attach higher at my rib cage than the average pectoral muscles. So you can kind of see if I do this, that the line goes down here, and basically my nipple's kind of sitting on that line anyway. And if I'd had the pec line scars, but kept this areola size, the scars would have ended up going through the nipple anyway, because otherwise they just would have been way too low. So yeah, I just have really high pecs, which is fine. It's a thing. I can do this now without it hurting, which is exciting. Anyway, yeah, so I've been doing the massage every day. Finn says twice a day, but I also think he wasn't using scar tape that whole time. And I feel like I'd be going through a lot of scar tape if I was doing it twice a day. What massaging does is just kind of gets the blood flowing, releases the lymphatic fluid, whatever it's called. And yeah, it can just minimize scar appearance in the long run. So like they are quite light, which is cool. Also, as you can see in my first video, my breasts were quite far apart. So I have a pretty big gap in the middle, and I think that has helped reduce the stretching. When I have been stretching and I have felt the tug, I've actually felt the tug in my nipple, and I measured them, and they're not 38 mil, they've stretched to about 42. This one actually stretched a little bit more than this side. So I've been doing yoga for a week or two, and I've been doing some other stretches. I've got this little machine that I lie on and like put my arms back, and it stretches my pecs. And I felt the stretching in the scarring around my areola as opposed to the lateral scar. This side as well, and I've actually noticed the scars around the areola stretching a little bit, but I think that's fine. I kind of actually prefer that my areola stretch a bit than these scars, because the areola is going to be there anyway, and whether or not it's a little bit bigger doesn't really bother me. But if the scar line itself were to stretch, it would be more apparent, because there are more people who have areolas than scars, right? So I feel like they are kind of even. I mean, I feel like this areola is a bit bigger, but that's because this side was tighter. Like, I can't remember if I told you in a previous video, but I could do this with this arm, while this one couldn't go further than like maybe up here. I'm actually going rock climbing on Monday, and I think I'll be fine, and I think more the concern I have is just the fact that I haven't been climbing in a couple of months, and my muscles are just quite sore. 2 weeks ago I tried to do some push-ups. I made it to about 3 before I fell on my face. But a couple of days ago I tried again, I made it to 9 or 10, so I'm getting back to where I was. Cool, so that's 10 minutes of massaging. Now usually I actually do this before I get in the shower, but I've already had a shower today and I was going to film this, so I can't be bothered. Put my makeup on. I'm going out tonight to Thursday, which is a queer night on Thursdays. Alright, so I'll just wipe this off. I don't really know if you're meant to wipe the oil off afterwards or let it sink in, but I've read that the benefits of massaging with oil, most of the benefit comes from the action of massaging and not the actual oil, although like the oil does absorb into your skin and some of it's good for you. But then I put tape over and I don't want the tape to be sticky. I don't know. So this is 3M micropore tape. I got a few rolls from Andy, my surgeon. And then I got a couple of rolls from the shops. So Andy didn't tell me anything about massaging. I asked about it and he said, yeah, you can if you want. He's pretty relaxed about aftercare though. Some people have complained too relaxed. To which I say aftercare is kind of up to the individual patient and you can do your own research, which I have done. So Andy told me to put the tape on and then change it every 4 days. And it does hold in the shower fine. It just dries back to normal. But I've just read about the benefits of massage in scar reduction, scar appearance reduction. I mean, it's probably all cosmetic. But for me, I feel like, okay, it's 10 minutes a day. It also makes me feel good that I'm massaging, I'm getting in there. I also have an exercise I do where I stand up against a wall and I put a tennis ball there. My massage therapist, housemate, friend advised that I do this. So I'm standing up against the wall with the ball and just kind of going up and down and using the tennis ball to massage my pecs. I don't let it roll onto my nipples or my scars. I just let it stay up the top. But even just the stimulation of a muscle that's attached underneath the surgery site can help prevent acidic buildup or something. There's a medical reason for tennis balls. Last year I was all about Hosier and Halsey and Emily Wells, who is an amazing artist. Yeah, me and my mates are on 21 Pilots at the moment. I don't know, they're good, they're not fabulous. I'm probably going to find something else soon. Alright, so this is my daily routine, and my last step is I get my Lifestyles Luxe silicone-based lubricant, which is advertised as an anal lube, but I use it instead of silicone scar gel or silicone scar cover because it's the same silicone makeup, it's the same base. This one does not contain spermicide. It's 100% silicone, but the one you want to get if you're going to get a silicone scar cover is cyclomethicone dimethicanol. There's like another kind of silicone that's alright as well, but then there's some that aren't that great for scars. So I've just been putting this on my nipples because they've been getting really, really dry, and the nipple site will do that. It'll get all dry and flaky and kind of gross. This can kind of get on your shirts or t-shirts and stain them if you put a shirt on straight away, but it seems like if you wait just 5 or 10 minutes and then put a top on, it doesn't transfer. I wear quite loose shirts at the moment though, so that might be different. Yeah, and this just kind of keeps them hydrated, and apparently it's good. So I'm gonna keep taping my chest up probably until I'm about 6 months post-op, so quite a while. And then after that, the tape probably won't be doing as much, but I might switch to silicone lubing my entire scar area for another 6 months. The first year of healing is really super important. The second year also can affect the scar's visibility long term. After the first 2 years, there's not a hell of a lot you can do. There are a few things, but I feel like if I do as much as I can in this first year, especially early on, that's what I want to do. It's not so much that I don't want scarring or that I'll feel self-conscious going outside topless on the beach or whatever with scars. I just feel like I want to see how much I can reduce the appearance. And if I can reduce it a lot, that's cool. If not, well, I gave it a go. And it's like a little experiment sort of for me. So I've been doing this every day. I've missed 2 days out of about 30 maybe. So I'm pretty consistent. And I'll see y'all for my next update.